Okay, good morning, everybody. I'm Councillor Jody Stoll, Chair of this committee, and I'd like to wish you all a warm welcome to the Adult Social Care and Health Select Committee that we are broadcasting live and recorded for publication. Okie dokie. Can we approve the minutes from the last meeting? If everybody is happy, with show of hands. Thank you very much. Martin, apologies for absence. Sorry.
Thank you, Chair. Councillor David Clark is substituting for Councillor Terry Cox, who sends apologies under the category medical reasons. Councillor John Siemens is substituting for Councillor Andy McCormack, who sends apologies under the category other county council business. And we also have apologies for Councillor Brian Wheatcroft for the category medical reasons. Thank you.
Thank you, Dom. Okay, declarations of interest. If any councillor or officer has an interest in any matter on today's agenda, you should declare it now. Please raise your hand if you have an interest to declare. If you have an interest to declare, you should state what type of interest it is, and please give brief details. Okay, thank you very much. Okay, we'll move on to item 4, which is the outcome of the big conversation of 2025. And if I could ask Councillor Answer, Cabinet Member for Adult Social Care, to introduce the report. Councillor Answer.
I think what is important is that, the reason why this is and what it's all about listening to the people that use our services, people that is the users, the carers, and everybody that's involved with social care and how we're looking after them. And this report is about listening to them people. We've gone into every district and done a meeting. I attended the Mansfield one, and I sat around various tables while I was there. We're listening to people's concerns or people's praises or people's just comments. And I found it very interesting to listen to what people had to feedback in order to get this report together. It's an update on the one that we've already got one out there already, big conversation. But it's about listening to everybody. And I think that at the end of the day, we take on board, I'm sure that the officers are going to explain this more in detail, we take on board what people have to say, good, bad or indifferent. And where we can improve our service, we're ready to offer the best service we possibly can to the users and to the carers, because they're very important, offer the service to them where we possibly can improve services that we're offering to them. And I think this is all part and parcel of the big conversation, and all part and parcel of listening to the users and listening to everybody and coming back with that information and then accumulating it in this report and then us acting on the basis of what we've found. So that's one of the officers now to go through that. Thank you.
Thank you, Councillor Answer. Would any officers?
Yes, thank you.
Thank you.
Hi, I'm Katie Ball, Director of Commissioning. So this is our second big conversation. So to build on how it works, in 2023, we had our first big conversation. We wanted to open up a conversation with people about what's been working well, what you're finding hard, what we need to listen to. So we work to the Care Act, but we know that co-producing our priorities and how we work is really important. So we tried this for the first time in 2023, and we worked with Our Voice, who are our strategic co-production group, and we also worked with an external organisation so that we've got a level of independent scrutiny. And so we had our big conversation, and from that work we then developed our local account. That's our adult social care strategy. So again, with that we worked to the Care Act, but it was really important to understand which things were people feeling in communities? What did they want to tell us? What did we need to do more of, think differently about? And so that's how we formed our local account. What we then did, so that was launched in 2024. What we then did is we had a forum called Making It Real, which has got members of our voice on, so people that draw on care and support and or family carers, that held us to account, and also looked at our performance reports, how we were tracking, how well we were doing with our local account. And the Making It Real forum challenged us, asked us questions about how we were doing certain things, and also decided on areas to do some deep dives where we might do more listening, more understanding about how it feels when you've got a direct payment, how well does that work with your personal budget, and lots of other areas. So that's how it's worked. So this is our second time around. It's really important that this is being partly led by our voice again. And we've pulled in another organisation. This time we used Think Local, Act Personal, which is part of a national organisation about co-production and best practice, so that we've got that level of scrutiny again. Really interesting that TLAP said they hadn't seen this done anywhere else in this way. So lots of co-production work happens, but to have something that is, we don't start with the focus. We don't arrive and say we'd like to do some co-production on day opportunities, or we'd like to look at this specific area. So the big conversation is completely open, and they thought that was really good practice, which was nice to hear. So again, we've gone out, as Councillor Answer has explained, we've been out to all districts. We've really tried to think about less heard voices, and people that we didn't hear from as much last time. We've thought about different ways of being accessible. So we've had surveys, we've gone out through all of our providers. We've asked our social care teams to think about people that might want to share their voice. So we've really tried to target in lots of ways to reach as many people as possible. And you'll see in the report the range of things that we've done. So today we're bringing the summary of that to you. It's quite an extensive report. It breaks down into lots of sections about how we've done it, what we've heard, who responded, the amount of people that we've heard from. So nearly 1,000 insights is we feel is really good, really positive. And there's a section in there that also compares to last time. So what we've heard that's different to last time, and where we've broken down what we think we need to do as well. So there's a lot of information in there. What we will do next is to start to form our next local account, so our next adult social care strategy, which will be based on this analysis amongst a number of things. So I'll pause there. It's a big report. So rather than go through it, might be quite useful just to go to questions.
Thank you, Katie. Can we? Well, okay, we'll go straight to for questions, and in that case, okay. Could I have a second, Joseph?
I'll second this.
Thank you.
Thank you.
Okay, I'm going to open the floor for debate, and Councillor Jackson.
Yeah, thank you, Chairman. Yes, a very good report, very glossy. But what have we learned from the last one we did to what this one? Have we improved? Have we got worse? Because it doesn't really say that. You know, there's a few bits and bobs where, you know, social workers aren't quite available like they should be. A lot of people don't like the digital communication, need more face-to-face. You know, so what have we learned? Have we improved?
Yes, what I'll add in there is a report. What do we call it? Our local account. What do we call it, Chris? Our summary from last year.
The local account adult social care strategy, is that what you're talking about?
Yeah, the one that summarises our impact. I've forgotten what it's called.
There is a section in the report. It is page 14. Sorry. There is a summary in the report that shows what's changed and what's different from last time. I can just briefly summarise that, if you like.
Sorry, I found the title as well. It's the Local Account Progress Report. So that came to Cabinet in February of this year, which we do an annual summary of how well are we doing, what does our impact look like, and what else do we need to do. So we do that on an annual basis, and then Chris can summarise from the big conversation this time what we think looks different as well.
Okay, so there is more technology-enabled care, home adaptations, and positive feedback on hospital discharge. But there are some persistent issues to do with housing, sustainability, transport, and consistency across districts. There's more person-centred and flexible support, but there's staff shortages and continuity issues still remain. There's also more broader engagement, as Katie referred to. This time we targeted people we don't often hear from. So there's more broader engagement with marginalised groups, and calls for inclusive community spaces and ongoing challenges with rural isolation and digital exclusion. Feeling safe, there's technology and adaptations have helped, but there are concerns about staffing, housing and hospital discharge issues still persist. Information advice, we've got improved websites and community care coordinators, but information remains fragmented and inaccessible for some. Direct payments are valued, but there's still confusion about eligibility and financial processes. For the workforce, positive experiences with individual practitioners, that there are concerns about continuity and training and turnover. And then wishes for the future, to sum up what people said. So this is both for people drawing on care and support and carers. There were person-centred assessments, joined-up services, more advocacy, accessible information, choice and independence, clear finances and ongoing feedback. For carers, it was about recognition, respite, simpler systems, more accessible information, support and training, and to be involved in decision making. And then for everybody, for both people who are drawing care support and carers, they were saying that they want to recognise that lived experience is a strength to grow co-production and improve accessibility and inclusion.
So where are other areas of improvement then? I mean, there's obviously things there, but are there areas that we improve the actual social care and that for people on a bit of our failings? I didn't really grasp that, where we've actually improved on what we're doing.
Yes, so in the report there is some summary of that, but I think probably what's more useful is to look at the local account progress report each year. So we will be producing one this year too. And in that report, it talks to a lot of things. It's an extensive report. So we've created more supported living for people to stay more independent for longer. More, again, technology probably will feature quite heavily. More people finding technology-enabled care really useful. We've been running a digital inclusion programme, and people can be referred into that. That's been really supportive, some really nice stories of difference. We have operationally, I think you'll be aware, we have restructured, redesigned the way that operational teams work. So they work in an all-age way now, and we're trying to make sure, and I think we're still on a journey with this, that people have a consistent social worker or person to talk to that knows their story. We're seeing that we're making progress in that, but there's more that we need to do. People do move on. So there are a range of things. So I think the progress report will be a key area where we do the extensive summary of performance.
Thank you, Katie. Councillor Rich.
Thank you, Chair. So I went to the big conversation in Ashfield, and it was interesting, to be honest, because they had different separate tables, a blind community, had different types of people with different health issues, and all on separate tables. It was like they had basically what could be improved, what doesn't work, and what's working, basically. And they had to come up with some ideas and such, which is great. One thing that got me going was that they had a picture and there's some drawing pictures of all the what was happening in the event. It was like picturing, colouring, and all this stuff. And I'm thinking to myself, what I'm hearing is a lot of buzzwords and a lot of visual summaries from this big conversation. That's what I got from this conversation. And I'm just thinking to myself, how much money is it costing the taxpayer for these events? And could it be spent on the services that we currently have? Thank you.
I think we could find out the cost of what we've spent, couldn't we?
Yes, yes.
So
We've definitely got a cost.
yeah,
We can share.
yeah, so we can do that, and we can send that afterwards. We can find that out. I think part of the Care Act is making sure that we are co-producing with people, we are listening. I think we know the evidence shows us to get things more right, we have to do that with people, and we can't just work from quantitative data, for example. So it has been a process that's been really important to us to help us with that big planning. It's also recognising your comments about buzzwords, which when we work in a certain context, we do use buzzwords, and we try really hard not to. We've been having a plain language, gloriously ordinary language approach. So we're trying to use simple, clear language. But also we're recognising that it's hard to take so much information from so many people and summarise it in a fair and representative way, which is why working with an external agency has felt like a good approach in terms of some of that challenge, so that we don't just have our Nottinghamshire way of doing things hats on, and that's why we chose to do that.
Yeah. Follow-up question, Councillor Rich.
So, a follow-up question on this. So, basically, on what I'm thinking is what residents want to scrutinise. We have in this panel here, they want to scrutinise the service. They don't want buzzwords. They want to scrutinise it so they can have a better service. That's what they want. I mean, it's nice to go out and do all these little programmes and talking to individuals. But if I spoke to anybody who needs help, they want to scrutinise to make sure this service works for them, not the other way around. If that makes sense. Thank you.
Yeah, and I think that's what we're trying to do. So we're trying to we are trying to talk to people in an open and honest way, and create spaces where people can be really honest. Because we do a lot of very targeted work. So, for example, with direct payments, we've had conversations with people that have a personal budget. How's it working for you? How are you finding the process? What could be better? So we're constantly asking those questions and hearing from people. We look at complaints, we look at compliments, are making it real for them. Scrutinises a lot of that as well. So we're trying to do that in a really transparent way. But I think what's different about the big conversation is it's not us taking a theme. It's us saying this is a completely open space where we want you to tell us anything that you would like to tell us. And that's what's a little bit different about the big conversation. So we're not guiding it.
Thank you, Katie. Sorry, Councillor Answer.
I think what is important is the fact that it's not us telling them what they're going to do, it's them telling us what they need. And the big conversation is about that. And looking at the numbers who attended the various places, Newark was a very well attended one. But I think apart from that, it's not just people attend the big conversation meeting, it's also available online. And this year we actually extended it by a further 2 weeks. So we're asking people who can't attend, they can complete the forms and stuff online and have their input. Because what is important, as far as we're concerned, is what they have to say. We can say this is good for you and this is what we're doing, this is where we do it. We might think that's the way it's good. It's about what the people that are receiving that service need. And the only way to find that out is to meet people. And sending people out to every individual is practically impossible. This allows us to have that conversation with everybody and anybody whether the carers, whether the users or whatever. It allows us to have that conversation. And you can see from some of the comments in there, this is not very good, or that's good, or that's great, it's not. We wouldn't get that on a face-to-face if the county council was to do it. They might not say things to county council because they think that's a threat to us. It's about being open, it's about being transparent, about listening to what they have to say, and then us, as an authority, acting on what we have to pick up from that report. And I think this is where we are. And we've just got this back. This is the first sort of draft of all that, in a sense. So we've got now to act on what we've seen and what we find. And if there is similarities from the last one that's not been addressed, then we want to know why we haven't done it. So I think that's what. Thank you.
Thank you. Councillor Girling.
Yeah, thank you, Tim. And I was going to moan that I didn't know about these big conversations because I would want to attend, but then found out that Councillor Rich knew about it. It might have been happening when I was successfully fighting my by-election, so maybe that was the case. But I think it's important that as councillors we go along as well, because it's, you know, they're our community that we're serving. And I think, you know, I like the fact that we've done it once. Second time, I hope we can overlay it so that would be very clear where we've seen progress and where there hasn't been progress. I worry about things like the carers that give up work or part of work and the finances because of that, because you know as well as I do, if then something happens to that person, their income's completely shot and gone. So I don't know how we'll solve that, but I think that's a really serious issue that needs to be addressed really. And the only thing I would say as well is like, I'd like to know that, because there's lots of groups out there that support the elderly. So, you know, there's the dementia carers groups and people like that. I do a fortnightly Sunday roast dinner for pensioners of about 55, sit down every other Sunday. We feed about 80 people altogether. There's a great source of people there that we could access and find out what's happening to them, because in fact it was great because I did an example because it was last Sunday that we did it. One of the guys is just really engaged with social services, and they've given this form to fill in, and he's not capable of filling the form in, you know. And so if he's not capable of filling the form in paper, he's most certainly not capable of doing it online. And I think we need to look at maybe how we can support those people to get it so that we know exactly what they require. Because I know from, you know, we did it where they had to phone me up and I'd book them in and things like that. Now we've done this booking system that's dead simple, but some of them still can't do it and we have to do it for them. And I think that's where, from my point of view, we really need to look at, because they're the ones that fall through the net, aren't they? The ones that don't know how to access a service. Because you get the ones who know, they get everything, they do everything, and that's great, but there's lots that don't. And so I'd like us to really concentrate on the ones that can't do it, really. So that, I know it's a bit of a statement, but I'm quite passionate about it because I'm getting old. So, thank you.
I was just going to absolutely recognise those comments in a lot of the things that we've found through a lot of our co-production work and our big conversation. People needing support to fill in forms is something that we're really aware of, and that can be everything from maximising your benefits through to applying for jobs. There are lots of people that need help with forms. So we have got support in a range of ways, and so has the voluntary sector, but we know that it can still be really hard if you're somebody that doesn't know about any of that, despite all the ways we're trying to promote it. So absolutely recognise that. I was just going to also pick up on your point about there are so many fantastic groups out there that are doing great things with people and creating social networks and circles and support. Met some really fab people. A gentleman at the Netherfield big conversation that gets, I think it's about 90% of his funding from local businesses to run a support group for a big range of people. And doing a great job. And it's always good to know about people in terms of us being able to connect people to. So picking up more people that we aren't aware of in the voluntary and community sector is brill. And then the point about carers are so important to us, and supporting carers is so important. We do have our carers strategy. We've had a carers co-production group for over 2 years. We've got some really good information that shows we've made a good impact, but there's still lots and lots to do on that. And I know the carers report has been here before, but a lot to do there as well. And lots of people that don't recognise that they're carers yet as well.
Thank you, Katie.
Yeah, if ever you want to send any of your staff to come and find out what they want and what they know and help them with forms, you're more than welcome to send them.
Thank you. Just for your information, Councillor Girling, the big conversation engagement sessions were in September, which was after your recent election win. No problem. Yes. Yeah, they were sent out by the previous director. Anyway, Councillor Gowland.
Thank you. I admit I was nodding when you said about the price, but then I think I take it back a bit, because I think I was actually nodding at the pictures, because I feel they look quite expensively made. But it's clearly critical that we do this with residents. My question is, did you separate the results by age of person being cared for? Because obviously there's very different needs for somebody who's 25 and somebody who's 75. And also people probably accessing SEND services to people with, chronic disability, physical disabilities. So I wondered if you've done that, because I imagine their experiences are very different. It doesn't seem to be here.
Sorry, I'm not used to being here. I apologise. So what we did this time round, as part of our reaching out to people we don't often hear from, we targeted young carers, and we had a dedicated session so we could gather feedback from them. And then at the same time, we went out and there was, we targeted dementia groups and in the community. And as Katie was referring to, there was a very useful contact we had at the Netherfield, the Gadling listening event, that we will pick up on next time we do a big conversation in 2 years' time, because of his contacts throughout the community with a wide range of people and age ranges as well. So is that?
Oh no, I was just going to follow up, so I don't just to try to fully answer. So no, I don't think we can fully. What we do know is who we've heard from. What we can't do is take all of the feedback, the themed feedback, and be able to cut it by age and a range of different ways. Part of the reason for that is we wanted people to feel comfortable on tables, just in lots of mixed groups, sharing experiences and kind of some of those different experiences being shared with different people. So as people were writing on post-it notes, it was a very kind of active, open way of doing it. So some people had people that were capturing their comments, some people were writing their comments, putting them on a post-it, wanted other people to read them out. Some people were happy to talk about their comments. So because it was collected in quite a mixed way, we can't truly then break it down in that way. But I think we've got a good sense, and I think what we have done and will continue to do is then some of that targeted co-production with different groups and about different themes.
I just add to that. With the online survey, we could break it down into age range, but not, as Katie was saying, not with the listening events, but yes, with the online survey, we can do that.
On page 24 or page 38, I'm not quite on there, it does give that report there regarding family and friends and carers. The following data refers to the people who completed the survey, and it goes by gender and then by age, identified with those who we spoke to there.
Yes, I've been looking at that, thank you. I assume, just to clarify, that the services are designed differently for younger people and older people. I mean, the most obvious thing is accessing digital support. Can you just confirm that?
Yes, so some services need to be tailored according to age. Some services are about accessibility, and if you might have a learning disability, we might need to do things differently for autistic people. So yes, our services can and do look really different for different groups of people. And there are some things that are all age, so carers support is all age. But of course, within that, we've got young carers support, young carers champions. We've got lots of bespoke groups coming together. So that might be a veterans carers group, for example. So under that all age approach, we have got targeted support.
Thank you. Councillor Girling.
That's right.
Oh, okay. Councillor Rich.
Thank you, Chair. So, when I was at the big conversation, there was a nice woman, a nice lady, sitting next to me, and she's works in the private sector for adult social care, and works in care homes, and she kept commenting about Scotland and how Scotland's better when it comes to adult social care. Is there any consideration of using any of their ideas at all, and then try and implement it into Nottinghamshire? Just a question's thought.
So I'll take this more from my own personal experience of the adult social care and health system in Scotland. So Scotland have a fully integrated service between health and social care. However, what I would say, and this is just from my own personal experience of my mother's journey through dementia, it's no better or no worse than the offer that we have here. It's still, very similar journey. The same issues come up. So, there's always things that we can learn from elsewhere, whether that's in Scotland or other authorities closer to home. And we do that, we do look beyond our own borders. We do look at what other places are doing, and we all do. We all steal the good ideas from one another. So that's always part of our development journey. But I wouldn't say that the Scottish model is better or worse than what we have in England. But as I say, that's just from my own personal experience.
Councillor Butler.
Yes, thank you, Mr. Chairman. Well, the nature of whenever you do a survey or a consultation like this, you're always going to hear the good and the bad, and quite rightly so. And of course, we only tend to concentrate on the bad, don't we? Because we want to make things better. So there are a couple of things in the report which perhaps don't surprise us too much, because I suspect we've heard it before, and yet we don't seem to be moving on so much. And a couple of examples will be issue of social workers, people sort of saying things like it's taking a long time for them to be allocated a social worker, or indeed have a regular named social worker. So really, I think what we need to know is why is that, and what are we doing about it? But then, and also in other arenas, you often hear people talking about prevention, and hopefully people not needing to get into a position in their lives where they will be struggling and where they will need help. But then somewhere we're seeing comments that prevention is still somewhat lacking, and too many people seem to be falling into a position where they've hit a crisis before they get any help from us. So I know you're aware of that, we're all aware of it, but what are we doing about it?
Thank you. So in terms of people waiting to be allocated a social worker, Emma's not here today, who leads our operational teams. And that is something that Emma and her team have been working really hard on, in terms of making sure that people don't wait too long. If people are waiting They take a waiting well approach, and there's a number of things that they do to look at risk. So trying to really think about keeping people well while they might be waiting. But then when people have been allocated a social worker, trying to make sure that that remains consistent for as many people as possible is what Emma's been working on. And I think it's fair to say we're part way through that journey. So I think we've got some evidence where it is working and some evidence where it's not. So that is a continuing piece. In terms of prevention, the big answer to that is in Nottinghamshire, we've got a really wide prevention offer. When we look at what other local authorities are doing, we do a lot of comparing, we share good practice. So there are lots and lots of things that we do here that are good in terms of we've got an integrated community equipment and loan service. We can get equipment to people the same day or the next day that might need it. We do lots of adaptations in people's homes. We have reablement workers. We put tech in really early to help even with assessment, as well as helping people early on. We've got contracts with the voluntary and community sector. So there's lots of things that we are doing well. And we hear lots of positive stories of difference of how that's really helped. Equally, we also hear the stories where people have got to a crisis, and that might be people that weren't known to us. It might be where we're seeing some gaps, where we're trying to work in a partnership way, for example, with our health colleagues to look at mental health reablement and support so that we can get quicker support to people before they get to a crisis. But also looking if people might have had a period in hospital, when they're coming out of hospital, what that support looks like for people, and to keep going to make sure they can get back to independence and the life that they want. So I think the answer is, again, there are lots of things that we're doing well. There are some areas that we are focusing on where we want to bolster those things and make them work better. But I think we've got a good understanding, is hopefully, I think we feel quite confident that because we do talk with people a lot and we are seeing both ends of things that are working well and things that haven't, we've got a good understanding and we've got work happening in those areas.
Thank you. Councillor Butler.
On the prevention side of things, I mean, because I know it's a tremendously challenging thing. Because at the end of the day, we're dealing with human beings with all the different foibles and all the issues that everyone has got. But are there any issues with the other agencies that we work with? So you mentioned now that there are people out there who we don't know until something bad happens. How are things generally with, because we hear about all these partnership workings and working with other agencies, bodies, IDPs and all that, and I know I'm falling into acronyms here, and that's another criticism, too many acronyms, and even we get confused with those. But how are things? It's probably a very basic question. How are things with the various agencies? Are we having the right sort of contact with the other professionals who can somehow highlight at an earlier stage that Mrs. So-and-so, Mr. So-and-so is a potential client, person who's going to need our help? How are we doing? And then the other point you made about the other points I mentioned about work in progress. What are we going to do about finding out how that progress is going?
Okay, I think I'd give a really balanced answer in that sense. I think we try to be a good partner as an organisation. I think across Nottinghamshire we do have really good partnership working. People want to work together. People want to help and do the right thing. So I think at all levels, in terms of those agreements about funding, those agreements about having working groups around something like supporting mental health at an earlier stage, those things all exist. I think our operational teams on the ground work really hard to work together as well, and that includes the voluntary and community sector. But I think it's fair to say across Nottinghamshire there have been a range of pressures on different organisations that are well known, and that can be really hard. Funding can be really difficult as well. There is an amount of funding, and it's about in a partnership trying to plan that and use that in the best way. But also outside of that, thinking about how do we all as good partners enable our teams on the ground to have what they need to be able to do the best job that they can, and for people to know that those teams are there and be able to talk to them is really important. So you might have heard quite a lot of conversation about that integrated neighbourhood working and recognising working in local areas in a joined up way, including with our voluntary and community sector. And lots of our workforce have done that for decades, and do that really well. But sometimes other barriers can get in the way in terms of funding, professional boundaries, some of those things. So supporting teams on the ground with the right information to be able to do what they need to do is really important. And we're having a lot of conversations at the moment in that partnership sense about supporting that integrated neighbourhood working. And I think all of that policy direction from the NHS end as well, that is about shifting back to more preventative work, is really what we all know and want. So shifting from acute to community, shifting from analogue to digital, shifting from illness to prevention is really important. And that's what the best staff have been trying to do for years and years and years. Making that happen, being able to move resource is hard. And it's something that we're all pushing and trying to do.
Thank you. Any further questions? Oh, sorry, Councillor Anson.
If I could just mention acronyms, I mean, you know, I honestly, I say to all the directors, I want to know what it says. I don't want to keep saying, what does this represent? What does this? It should be in plain English, not in council language, in plain English. And I've banged the drum about that all the time, just to let you know that we're fully aware of that.
Councillor Clark.
Thank you, Chair. I'd like to ask a question around hospital discharge planning on page 43 of the report. Just simply what improvements have been made to this area, particularly for people with complex needs, and how do we measure improvements in this?
So there's different elements of hospital discharge that we're involved in. So we support with discharge from our acute hospitals across the county. We also support with discharge from our mental health hospitals, both NHS and private hospitals within the county. I think, and actually it's not just my view, but actually our performance in hospital discharge from a social care perspective is really good. You know, we're responsive, you know, we support people home in a timely way. We make sure that they have the right support that they need once they're back home. We've got a really strong reablement service that will meet the person at their home as soon as they're discharged back and put in whatever support is required to stabilise them back home and assess whether they need some form of ongoing support or whether they can actually return to independence. There's always some frustrations around discharge. We get an awful lot of what we call abandoned discharges, where perhaps you know, we're notified that the person will be coming home today, and that, you know, we mobilise staffing, etc. But then, you know, medication at the hospital hasn't been finalised or hospital transport hasn't been arranged, and that person's discharge is then pushed back, which does mean that, at times we end up with lost capacity because we've waited for a discharge that hasn't happened, and we could have used that capacity in a different way. So there's always frustrations. The hospitals, I'm sure, would like us to discharge even faster and with even more people, but we do maintain a principle of safe discharges. We want to make sure that people are well enough to be discharged home, and that actually, it's we can put the support and the care in to make sure that they're not then returning to hospital within 28, 48 hours. So we have a good range of services and supports. We have hospital social workers who are based within the acute hospitals who will assess people on the wards. They work really closely with ward staff, with doctors and nursing staff, to make sure that people are well assessed from a social care perspective before they even leave the hospital setting.
Do we have a mechanism for measuring performance and seeing if this is improving over year on year?
Yeah, there are nationally reported performance indicators for hospital discharge, which picks up both NHS and local authority activity, and I can provide the link to that if you're interested in seeing that. We get a weekly report, generally on a Friday, about what the discharge activity looks like across the county. That's mainly around the acutes. We're not quite there in terms of mental health discharge, although we are developing our own dashboards for that because they don't exist in the same way that they do for acute hospital activity. But yeah, it's very well monitored by NHS England. And as I say, there are weekly reports that come out to show the level of activity, how many people have been discharged, which local authorities have picked up how many, or other organisations that support with discharge, because it isn't just us. There are other organisations such as the Mental Health Trust have community healthcare who support discharge. And also within, obviously there's a little bit of transfer with people that live in the city. So there's organisations like City Care who support city residents with discharge from our hospitals. But yeah, it's extremely well monitored. There's really clear performance indicators, although not for local authorities. We are not required to have a minimum level of activity around discharge. What the Care Act says is that we will support the NHS with hospital discharge, but we don't actually have specific performance targets that we have to meet, but the NHS does.
Thank you.
Okay, thank you, everybody. Just an observation from myself. I've sat in on a couple of the Our Voice discussion teams, discussions that we've had with the team, and around the big conversation from this year. And it's clear that we've gathered a huge amount of data. And I think one of the things that we're very good at, that I've observed in my short tenure here as chair of this committee, is that we are good at engaging with the residents, and it seems to be, for want of a better phrase, a passion, I guess, to solicit the feedback and shape services from a resident-led service user approach, which is really good to see. I think everybody on this committee will look forward to seeing the recommendations, and as we fully understand the data going forward, that we do see some of the outcomes from the big conversation actually being translated through into an improvement in services across the board. So thank you. Martin, anything that you'd like to add?
Yeah, it was a really good discussion. I'll make a note in my diary, so when the cabinet report on the local account goes, I'll make sure that's circulated to members. We'll also share the cost of running the exercise with members of the committee. And then just around the hospital discharge, members will be getting a adult social care performance report circulated outside the meeting sometime in the new year, and hospital discharge information is included in that. I'd also note that we have looked at hospital discharge in detail quite a few times at this committee, so the reports are in there. I think it was like March of this year that we last looked at it, so if you want to go back, you can have a look at that report. And we'll also make sure that the link that Ainsley spoke about that shows you where you can see like more up-to-date information about discharge levels are circulated to members.
Thank you, Martin. Okay, we're going to move the recommendation. Councillor Rich, could you?
He's done it already, so he just needs to take the vote.
Okay, let's take the vote. Thank you. Okay, moving on to item number 5, progress report of Nottinghamshire Safeguarding Adults Board against the 2024-25 strategic priorities. Ainsley, would you like to present the report, please?
So this is the annual progress report of the Nottinghamshire Safeguarding Adults Board in relation to their 24-25 strategic priorities. So each year the Safeguarding Adults Board publishes a report that sets out their strategic aims, which are around prevention, assurance and engagement, and they give a progress update on the work that the board has undertaken over the last year, and also sets out their areas of focus for the coming year. So this is something that comes to this committee on an annual basis. So, you know, as time goes on, you know, some of you will have seen it before. It's really just to make sure that, you know, you've got that overview and oversight of what the board is doing, and an opportunity for you to raise any questions. I'd like to introduce Ross Leather, who's our Head of Service for Adult Safeguarding, and Ross will take you through the key points of the annual report.
Morning. Yeah, I'll just go through the kind of the headlines of the briefing paper you've got. In terms of the way it's constructed, there's 3 overarching themes of prevention, assurance and engagement, and then they've been broken down into kind of five themes. But moving forward next year, we've kept it simple, and there are just the 3 themes throughout. So the first theme is to improve communication engagement within the diverse communities of Nottinghamshire. So there are 4 subgroups within the board. One of the subgroups is the communications and engagement subgroup. That's a fairly new board, fairly new group, and they've devised a kind of media promotions kind of strategy with the comms leads of all the various partner agencies. So that's a new development. We obviously got a unique chance with the 2021 census to see how well we were doing in terms of the latest data. So we compared the demographics of Nottinghamshire against the cohort engaged with adult social care and the much smaller cohort that engaged with safeguarding adults. And the only real discrepancy potentially was that with the Asian communities, whilst they represent 3% of the of Nottinghamshire's population, only 1.7 and 1.4 respectively, those lesser data sets. So that's something that there's an area of focus for the board. Obviously, I work for adult social care and one of the partners on the board, so that'd be a collective endeavour that we'll undertake. Moving on to the kind of the second theme, which is to increase participation of people with lived experience of adult safeguarding. The chair is quite keen that we look at what's often called closed cultures. That's the propensity for individual agencies to, especially in the private voluntary sector, that that aren't as potentially as well engaged with them, with community, with partners, to develop a closed culture. We're not saying that there are closed cultures in Nottinghamshire. We're just alert to the possibility of that. So the ICB worked with the board to develop a quality and safety group. So all the independent hospital providers attend that group along with representatives from the board, and where best practice is shared. So that's going well. The board's commissioned Health Watch to undertake a patient, staff and family survey of practice in the Priory Hospital. That's an independent provider in the area. That's to kind of close off a non-mandatory SAR that took place in response to an incident in the Priory Hospital. So actually, whilst the board received assurance about the improved practices in the location, what better way to actually get real assurance than to go in personally and ask the patients directly concerned, how are things? So that's taking place now as well. Again, in partnership with Health Watch, we use them in a consultative capacity to develop a way to reach out to people with lived experience of Section 42 safeguarding inquiries. We've got a database of people that have indicated a willingness to be communicated to basically ask, how's it for you? And we took the opportunity to use that database to send texts out to about 300 people to ask some brief questions about their experience with simple radio buttons, and also to take the opportunity to say, would you be interested in engaging with the work of the board, so we can actually develop a co-produced response. So the feedback was positive, and we've got 4 individuals who potentially can support the work of the board in a kind of co-production capacity, and we have the ability to go out again to that cohort of people to refresh that group on an ongoing basis. So that's quite an innovative piece of work. Moving on to the third theme, quality assurance and performance monitoring. I draw your attention to the transitional safeguarding working group. That's a big piece of work that's involving 4 boards, children's and adults, city and county, all coming together, which in of itself is quite a good innovative approach, and looking at addressing the issue of transitional safeguarding. And by that we mean there's a recognition that people experience a greater risk as a transition from certain cohorts, transitioning from childhood to adulthood, are a greater risk of experiencing abuse as we understand it within the Care Act. So there's lots of low-hanging fruits being picked in terms of training slides and so on and such forth. We're now moving into the kind of more complex area of work. That group will be standing for quite some time, I imagine. In terms of KPIs, this is adult social care data, but the headlines are that we received just over 11,000 referrals last year. That's in line with the national increasing picture. Again, this year, I can already tell you now that the numbers are still going up. In terms of abuse types, neglect remains the most frequent type of abuse, followed by organisational abuse and physical abuse. And the location of abuse is unfortunately where you might expect. It's where care is delivered. So it's in people's own home, in residential care, nursing, in the community. There are 4 what we call MSP measures, but they're making safeguarding personal measures. We report those to the government. NHS Digital publish those yearly, and I won't go into detail, but the 4 measures there were either reaching or exceeding all our own targets and the national averages. So that's indicative of good practice on the ground. Moving forward onto the 4th theme, the governance, structure and support functions. The executive group, although it was developed the previous year, that seems to be working well again. The communication group, I think, is new to this year, the year we're discussing, and that's working well. There's a lot of activity in respect of revising the raising a concern and referral procedure, which is a referral procedure that's shared by all partner agencies. So that's been upgraded. And there's ongoing work in terms of learning materials, lots of activity around the National Safeguarding Week, which we use as a chance to kind of promulgate good practice, as do all our partner agencies nationally. And then concluding with the 5th theme, which is collaboration and partnership working. We, at no cost, commissioned Making Connections consultancy to look at what is a SAR impact tool, which essentially is an audit tool that partner agencies complete once they've concluded the recommendations and the action plan from a SAR, Safeguarding Adults Review, which is a statutory function the board also undertakes, to see how embedded the change in practice within their respective agencies is. That essentially got a thumbs up from Making Connections, and they thought that was an innovative piece of practice. The M22 and N22 reports have been published and action plans developed, and we will be using the SAR impact tool to follow that up. The non-mandatories I've already mentioned in respect of the Priory, and the other work I draw your attention to, obviously we promoted the work of right care, right person. That's a national rollout that the police nationally have taken. The impact in Nottinghamshire is fairly minimal because Nottinghamshire Police had a very similar procedure called most appropriate agency beforehand. So the actual impact on the ground's been minimal, but all partner agencies meet regularly with the police to kind of assure themselves that that's been implemented as we'd like and that there's learning from any incidences. And then the final piece of work I'd like to draw your attention to is the Severe and Multiple Disadvantage Working Group, SMD. That's people that experience either a substance misuse issue, a combination of substance misuse issues, mental health issues, homelessness, or involvement with criminal justice agencies. So these are people that present with lots of complexity, and the board recognise that as an area of focus, and our public health partners instigated a 6-week kind of training kind of workshop, kind of bringing a lot of people together from various agencies, a lot of middle managers, myself included, and then we segued from that kind of workshop into a standing working party where all these people from all our agencies will look at how can we improve the response to the people we work with that experience severe and multiple disadvantage. And again, that I envisage will be a piece of work that will carry on for quite some time. I think that's a bit of a kind of whistle-stop tour through the paper, if that's okay.
And just to give you a quick summary of who the partners within the board are. So there's ourselves as County Council, Nottinghamshire Police, as Ross has mentioned, the Integrated Care Board, all of our district councils, East Midlands Ambulance Service, Nottinghamshire Fire and Rescue, the Probation Service, we have advocacy services as part of the board, Department for Work and Pensions, and Care Quality Commission. So it's a very wide-ranging partnership, and we have an independent chair who does bring, quite a lot of background knowledge. He's an ex-police officer, so is very knowledgeable and experienced regarding the safeguarding world. So it's a really strong and diverse partnership that brings different perspectives from different agencies. But Ross and I are happy to take any questions that you've got about the report.
Just a very quick one, Ross. We've been talking about the need for clear language. I'm not sure that all members would understand what a survey with radio buttons means. Yeah.
My apologies. Sorry. So it's just in terms of technology, it's simply just a yes, no. Just click the button, yes or no, and on the screen. Simple as that. It just flicks one way or the other. You can't have both. Does that answer the question?
Binary choice.
Binary choice. That's the one, much clearer than I could have managed.
Okie dokie. We'll move. Sorry, is that anything else to present? No. Sorry, I think I was jumping in there. Okay. We'll move the recommendations and seek a seconder.
I'll second it.
Thank you very much. Okay. Could we open the floor for debate? I think it was Councillor Butler first.
Oh, thank you. Couple of questions. I'm looking at paragraph 8. This well-being and response to scandals, and you're working, the ICB working with a forum of open conversations, sharing best practice, etc. Are we sure that all organisations are fully on board and involved, and are we in touch with them? In other words, do we know that we're talking to all the providers that we need to be talking to be absolutely sure that there, as sure as we can be, that there is no potential for anything unacceptable to happen in Nottinghamshire? And also, and then following on from that, it's a technical point, going back to jargon again, I'm afraid. Paragraph 9. Perhaps I should know this, but I can't remember if I do. What's an M22 mandatory SAR, please?
Oh, that's fine. I'll answer that one first, if that's okay. So the way the board designates SARS is an initial and then the year. So that's what that is. And a mandatory SAR means it's a safeguarding adults review. It's under Section 44 of the Care Act. There are criteria laid out, which means that if those criteria are engaged, the board must undertake a statutory safeguarding adults review. Safeguarding adults review is a review of an incident that happened where someone either died or nearly died, suffered harm, and the point of the review is to identify learning, so to make that possibility less likely to occur in the future. It is not a stick to beat agencies with. There are other bodies, other ways of doing that, crudely. So it's about identifying the learning and applying that learning with all the partner agencies within the board. So that's that question. And in regards to the first one, yeah, the ICB run that. I've not actually been to that meeting, but I'm assured that all independent hospital providers attend, and it's running well. So I think, as much as I can provide assurance that yes, the right people are in the room.
Thank you, because it's the assurance that we need, isn't it? Because the last thing anyone wants is sometime in the future something to happen, and then all the enquiries and all the rest of it show some sort of lack of something, which we don't know what. But if you're as assured as you can be with regards to that.
Yeah. Just to add to that, all of those, whether it's an independent or NHS hospital, they will be subject to regulation and inspection from the Care Quality Commission. So, the eyes that are on these services aren't just through the Safeguarding Adults Board. There is a regulatory framework where they are checked and inspected. So any issues around, closed cultures or any sense that, practice is not what it should be picked up by that regulatory inspection.
Thank you. Councillor Girling?
Yes, yes, please, Chairman. It's sort of along the same lines. It's all about confidence, isn't it? We need to have the confidence that the safeguarding has been put into place, because we're still getting scandals, and the Care Quality Commission have always been part of it. The Integrated Care Board have always been part of it. The user groups have always been part of it. So have the providers all been part of it, so it's the same people marking their own work again. So that you're telling me that we've moved on from all that, because we still get the scandals with all those people that are supposed to be there protecting the vulnerable that we look after, and it's still happening. And what I'd like really is absolute. I know you can't say absolute in terms of that, but your confidence that you have done as much as you possibly can to try and prevent anything happening again, and the scandal happening again. And what I'd also like to know, do we, these providers, are all the providers engaging? Yeah, because you have these provider groups, but are they all engaging? And do we have any concerns about any of the providers we've got at the moment? Are they where we're starting to think, hang on a minute, these aren't doing what they should be doing? And if we have, what we're going to do about it? Thank you, Chairman.
So I think there's two separate parts to this, Councillor Gerling. So the Safeguarding Adults Board is not a regulatory body. So they do not have any powers over any provider in terms of, inspection, in terms of assessing their fitness to practice or anything like that. They are a partnership board. And, the work that the Safeguarding Adults Board does is about, working in partnership with those providers. As I said, in response to Councillor Butler's question, the regulatory framework sits with the Care Quality Commission. That's where the regulation and inspection comes in, not through the Safeguarding Adults Board. The board works in partnership and invites providers to engage. As Ross said, the providers within Nottinghamshire have engaged and have engaged positively. And certainly from what we've seen through the work of the board, that engagement is there. but the inspection and regulation does not sit with the Safeguarding Adults Board. That sits with the Care Quality Commission. In terms of, other provisions, so whether it's care homes or nursing homes, etc., or other care services within Katie's area, we've got quality and market management team who do go out and assess and inspect to a degree all of the providers that we commission through the council, but that would only be our contracted providers. It wouldn't be NHS contracted providers, although some of Katie's team do operate within a joint role with the ICB, so we'll also look at some of those. So I think we just need to be clear about where some of those lines of regulatory responsibility sits, and it doesn't sit with the Safeguarding Adults Board.
Yeah.
I understand that, but that's where we get gaps, isn't it? Because you can only go so far, then the other ones can only come down so far, and then that's why we end up with scandals, because people fill through the gaps. So what are we doing? So I know we might not be able to do inspections and things like that, but surely if we've got concerns about somebody, a provider, then we've got some weight with the Care Quality Commission to say, hang on a minute, look, you've got to go and inspect this. Surely that happens, and also you didn't ask my last part of the question. Do we have any providers at the moment that we are concerned about? So I think that's really important that we understand that, because I'd like to know if we have, what we're doing about it. Thank you.
I was going to say, I was thinking about how to respond to the last part of your question. Yes, we do raise concerns with the Care Quality Commission. So if we were to see something or hear something or get feedback from whether that's someone that's, access to service or, their family member, that didn't quite sit right, yes, we do feed that into the Care Quality Commission to say, we do have some concerns, or sometimes it may be that we are seeing multiple safeguarding alerts come in about a particular service that then again raises red flags. And yes, we will alert the Care Quality Commission to any concerns, or if it's things that Katie's team are seeing on the ground. So yeah, we do have that ability to feed in our concerns to the Care Quality Commission so that they can pick that up. In relation to the second part of your question, and I probably will be a little bit cagey, I think in terms of, some of these, so particularly in the space of, mental health, I'm sure you know that mental health has been a bit of a poor relation for a very, very long time. Mental health hospitals always concern me a little. We've had an awful lot of very high profile incidents around mental health over the last few years. Obviously at the moment the Mental Health Trust are under a huge amount of scrutiny in terms of their own delivery and practice. So, I wouldn't say that I don't have any concerns. I always have concerns around mental health, particularly inpatient services, because I don't think they're potentially where they need to be in terms of quality. But that's something that is a much broader issue that needs to be resolved centrally with central government and making sure that we get the right investment into those services. I don't think it's something that individual providers can solve on their own fully. So, I wouldn't say I have no concerns, but there's nothing at the moment that is ringing alarm bells in terms of any one particular provider. Yeah.
Councillor Wright.
Hi, morning. Item 15 regarding neglect it said this pattern is broadly unchanged year on year. Is that means it's awful and it stays awful, or is it really good and it stays good?
Wherever you've got vulnerable people, you will always have people who will take advantage and, you know, potentially not act in someone's best interests. Of course, we'd like, you know, the figures to be zero and that nobody experiences abuse or neglect in any setting. The reality is that, you know, you'll never get to a zero position on that. You know, the numbers have remained fairly static. I would like it to come down further, and I think there probably is more that we can do from a Safeguarding Adult Board perspective, and it's something that I've spoken to the chair about in terms of you know, what does good look like? You know, getting back to the basics of what does good care and support look like, making sure that you know, people receiving care and support know what they should expect, making sure that families know what they should expect in terms of good care and support, and if they're not receiving that, what do they do about it? Where do they go? Who do they tell? But also that frontline staff are much more able to challenge where perhaps you know, the people that they're working with aren't perhaps you know, treating people in the way that they should be. And again, yeah, how to whistleblow, how to raise concerns, either anonymously or otherwise. Ross, I don't know if there's anything you want to add to that in terms of the numbers.
Well, I think the numbers are, I suppose we're broadly representative of the national picture. Nationally, these are the most common types of abuse. So what we're seeing locally, we're not seeing anything different, unfortunately, to what other areas are seeing.
I just wondered where the bar is. Is the bar horrendous? Is it bad? That's what I'm asking. So
Yeah.
we're just saying, well, it's kind of there and it's not moving. There's no definition. You see, my concern is that I'm sure there's abuse happening right now. What are we doing? What are we doing proactive to go out and stop it? Are we knocking on a care home door at 3 a.m. and checking the night shift aren't all fast asleep? Are we doing that? Are we going to give it to another body to do that? We've got to have some responsibility. If we want to put it down here, we've got to start taking some responsibility of it.
But that's the role of the Care Quality Commission, and they do go out and check on.
Okay, so who polices them?
Sorry?
Do we police them?
No,
or
we
do we
don't.
just rely on what they say?
No, the government polices them.
Okay, so what about where we have our partnerships, where someone who will do a care home and we'll have a business partnership with that? Do we leave them to police that, or do we police it?
No. So there's two levels to it. So Katie's team, the core team, market management team, will go and inspect.
Randomly?
Yeah, they go out.
Out of hours?
Yeah, no, they do.
Early hours?
Yeah, they will go any time of the day.
I'd like to. I mean, I don't need full data, but I'd like to see a call sheet on that. I'd be impressed.
I'll just come in on that. So we gather loads of information. Every week, my market management team meet with operational staff. So anybody that's so we've got operational teams out doing reviews, assessments, etc., visiting people. Every 4 weeks, we meet with a whole range of partners, including CQC, health, fire and rescue, whole range of information. So we are constantly taking a risk-based approach to where we go in and monitor. Every year, we go out and audit all of our providers that we contract with, and we're gathering themes of what we're seeing in there. Where we see lots and lots of really good practice. And one thing I would say is I think that we now have no inadequate homes in Nottinghamshire rated by CQC. and we have a much higher level of good and outstanding homes when you compare to nationally. So that's quite useful to know. But doesn't mean that things are right everywhere. So we use that information. We have staff, so staff out in providers that might contact us and whistleblow if they're not happy with something. So we have lots of information. We audit everybody each year, but also according to that information, we will just go out and do a random visit at different times of day. If we're not happy with things, if we think that something is unsafe, we will immediately work with operational teams and health where appropriate, and we put a team on the ground really quickly. So we have had people that are visiting through the night. So Ainsley and I might be getting WhatsApps at midnight, at 3 a.m, etc., and teams are in there. Because we work in a really joint way with health partners, we can pull people in quickly. So things like medications not being right and staff not understanding what they should be doing, we can get an expert into that home really quickly that does an audit to look at, has everybody got the medication that they should have? Is medication locked away properly? Are all of those things happening? Once they've done that safety bit, they can then look at, okay, staff here needs some training immediately. Whilst my teams are then looking at the leadership and management in that home, for example, and going through everything. So looking at staff training, are enough staff on? So as soon as we arrive on site, are enough staff on that should be on? And if they're not, there's immediate action on that. Visiting everybody, talking to people, looking at care plans, are the right things in place? So we can move really quickly when we need to. At all times, we've got providers that so we have we call it our ROIG. It's red, amber, red, orange, yellow, green. Get that in the right order. So we rate providers in terms of risk, and so we're looking at that information. At all times, we have got providers that are red or orange, and that might mean that there's something contractually that's not right, through to there's something that we're really worried about in that home. So we will have action plans in place saying you need to do these things by Friday, you need to give us evidence, you need to do these things. Sometimes it can be okay, you need to work on something that's not safeguarding, but something else that's about good practice, and we will give providers a bit longer. If it's something where we're worried about the safety of people, we call a team meeting, and we are having kind of 24 hours. These things need to be done. We'll have staff on site doing things, and as a care home, you need to do these things this 24 hours, and we'll move in that way. And that's where we work really closely with the CQC as well. So we've got a good relationship. We phone them immediately. We say, we need to tell you these things. They will then take their decisions about when they visit, or what information they want back from us. So we work in that shared way. But ultimately, they will take a decision whether to close somewhere, or whether from the information that we're giving, we think they are improving and can get back to good. We don't want to move people if we can, but if things are not, because that's not great either. This is the home for people. But equally, if something is not safe and we can't see that it's improving quickly enough, then either the home has taken a decision to close, or we've worked with CQC and CQC have taken a decision to close. We then support people to move safely. We work with people, we work with their families, wrap around them. We have seen lots of really positive stories when people have moved, where they've been able to move towards their goals more quickly. We've seen people with dementia flourish when they've moved to different provision. So we work at all of those levels just to give that assurance.
Councillor Jackson.
Yes, thank you, Chair. I've got a couple of questions, actually. The first one was nearly asked, carrying on from what the last question was, that it's always worried me or concerned me who actually scrutinises the CQC. There seems to be a very reactive group, very reactive. There'll be some high case things in Nottinghamshire recently over the last 2 years, and they're all over it once it's happened, but they're never there before. They're not proactive. I just wondered why and who's scrutinising them and what their remit actually is. You hear a lot about the CQC, but I don't know whether we can answer this question or not. But they never don't seem to be very reactive to me before something happens. My second question is, we now live in a very diverse, multilingual, multi-religion, people with different beliefs, different ideas on society, you know, especially towards women. Do we have the resources to look into that, into different sections of society and life like that? Because there are certain ghettos getting around society, aren't they, which we are probably locked out of. And I just wondered whether we have the resources to get into those areas which seem to be gathering these days.
So in relation to your first question around CQC, Councillor Jackson, so CQC are answerable to the government. They have had a bit of a bad press in recent years. You know, their leadership has changed several times over the last 2 to 3 years. Their inspection regime has not quite got back up to speed following COVID, when they couldn't actually enter care homes and care settings easily. They are now starting to catch up. We actually have them in this week inspecting our adult social care provision within the council. So at the moment, we're right in the middle of CQC inspection ourselves. So they are catching up, but they are answerable to the government ultimately, because they're a national body. They are, you know, they have regional offices, but they are a national body. In relation to your second point, our duties regarding, you know, sort of our statutory role within the Care Act isn't so much looking at specific cohorts. We will pick up people who have been subject to, you know, abuse and neglect as an outcome of their care and support needs. Those are kind of the thresholds that are set within the Care Act. I think probably what you're talking about, Councillor Jackson, is more a public protection lens almost, which probably fits better with some of the public health initiatives that are running at the moment, rather than specifically our duties around safeguarding. There are times when Safeguarding Adults Board will look at a particular cohort of people because we've had a significant increase perhaps in safeguarding referrals, which is why they, you know, put a bit of a spotlight on mental health hospitals. That was in response to some of the recent issues and, you know, well publicised incidents that we've had locally. But yeah, safeguarding is less about kind of public protection of, you know, sort of communities or particular cohorts. It is about how we safeguard people who may be vulnerable to abuse or neglect as a result of their care and support needs.
Okay, thank you everybody for your questions, really useful. I think what I would like to see from my observations is a deeper level of training for all members, not just of this committee, but for all elected members across Nottinghamshire County Council into the full ins and outs of safeguarding. I think everybody knows from a high level what safeguarding is, but we can see from this report there's a lot more in it. So perhaps that's something that we should look to arrange in the new year for all members, some kind of engagement session, you know, whatever that looks like. But I think it's something that I would like to see, and I know from speaking with other members, they do find safeguarding quite confusing when you get into the ins and outs of it. So thank you. Councillor Answer.
Thank you, Chairman. Yes, I was a bit concerned about safeguarding and there are all the councils and everybody's involved, the police and fire brigade, everybody's involved in that. But my concern was the fact that there's no member involvement in that. It's basically done by other people, and we don't get any involvement until they want to be involved us. So just to inform you that I will be going on to the safeguarding board as from last week, in order to put some member representation there to ask questions, to challenge within that group. It's not about wanting to control or do anything, it's wanting to understand it and so that we can understand it, which we don't have that facility now.
Excellent. Yeah, no, that's brilliant. And that's exactly what we need. You know, member involvement and member engagement. So perhaps these sessions, you know, we could look at bringing in some of the wider agencies that we talk about in this report, bringing those into the sessions so that members can understand who they are and what they do. So yeah, something we'll look at. But yeah, thank you for that.
Yeah, I mean, we can certainly look to pull together a bit of an information session that we can offer out to all members. If you could just give us a little bit of time, because unfortunately, my colleague here is just about to leave his current role as head of service for adult safeguarding. So I'm going to have a little bit of a gap before the new appointment can start, because she's on a 3-month notice period, unfortunately. So if you could just give me a little bit of time until we get the new head of service into post in April, and then we can set something up.
Okay, wonderful. Thank you very much. Okay, can we take oh, sorry, Martin, any further observations?
Just a couple of things. I've just noticed some massive apologies for this. We see on the work programme, we seem to have published the covering report twice and not the actual work programme. Because I was just about to refer to the work programme. I've just had to get it off the website. At the 18th of March meeting, we have got an item on care quality and assurance. So just to read out exactly what it says on the work programme. To examine care quality and assurance in Nottinghamshire, in brackets, regulated services, social care market oversight, care quality commission assurance and internal audit activity. And there will be representatives of the CQC being invited to that meeting. So I think we'll be able to have a good discussion and gain that assurance at that time. And then just to note what the chair has just said, so we will request a training session for all members on adult safeguarding. But as Ainsley said, that will be probably like more in kind of like late spring, very early summer when the new head of service is in post.
Thank you, Martin. Okay, recommendations have been moved and seconded, so we'll go to the vote. Okay, thank you. Okay, we'll move on to item number 6 on today's agenda, which is the Day Opportunity Strategy. And I'll hand over to Councillor Answer to introduce the report. Thank you.
Thank you, Chairman. Obviously, this is the purpose of this report is to provide an update and implementation of the Day Opportunity Strategy from 22 to 27. But this is about the update, highlighting progress against the identified commissioning intentions on the developments taking place within the county's direct day services. And I'd ask an officer to put this forward, please, as to where we are. Oh, where we are now.
So in April 2022, we produced a 5-year day opportunity strategy. And I think we had 1,500 people, didn't we, that shared their views into that strategy. And there are a range of themes, but it was about making sure that people could maximise living the life they want to live, working towards their goals as part of their community, meeting at places that matter to them, doing things that matter to them, getting more opportunity to volunteer or be supported into work, etc. So what we were signalling in that strategy to a certain extent is a move away from everybody being in a buildings-based type of support and people having support as part of their local community, building social networks, etc. It doesn't mean that we never need any buildings based support, but that we create a greater range. So that's what we've been doing. And each year we have, again, a summary of the progress that we're making, which is part of what we're going to talk about today. And just to also note that we support 600, just over 600 people through external day opportunities support, and 700, and Ainsley will remind me, that's 60 people in our internal day opportunities support. So we've got a mixed model in that sense. So I'm going to introduce James Wheat, who is our commissioning lead in this area, to talk about the external support, and Ainsley is going to talk about the internal.
Thank you, Katie. Nice to meet everybody. So we recognised when we did the strategy engagement, so we had lots of people who wanted to share their views. I think what was a prevailing view was day opportunities, day services really mattered to people. They mattered to the individuals who use services, to the carers who benefit from potential carer respite. But we also recognised that sometimes people were going to a service and it wasn't always really that clear as to what we were hoping in terms of our outcomes, our ambitions were, but we knew that it was important. So as part of this activity in 2023, we introduced new service specifications and contracts. So this is for all of our external delivery partners to try and standardise the way staff are trained, staff are recruited, how people are supported when they join a service, but not necessarily dissolve the breadth of things people do. So I think if our external providers were here, they would say no 2-day services would look the same, that it's a vibrant offer. And a key thing we've woven in, and I know Ainsley will talk about our internal offer, we wanted to give choice and control to individuals who are eligible to access day services under the Care Act. So we, as a council, don't say you're a person who must go to an internal service or you should go to an external. It's really clear people want a choice and control. Sometimes individuals like to access things closer to their interests or their location where they live. So this is what's being developed, and it's what we have right now. So people have lots of choice and control, have a list of services they can go have taster sessions with. And we've ended up with a model which tends to evaluate very strongly that people enjoy being able to access their opportunity, enjoy usually the outcomes. And I think what we've noticed in the report, it sets out just some really, I think, powerful statements on what people are telling us their experiences of day services are. But in terms of, as a commissioner, in terms of some of the analysis, what we have seen is more people are accessing meaningful things in the community. So it's a big signal to our external partners, who most of those are charity organisations, I should add. How can we support people to have more integrated and ingrained lives into the community, doing things which, you know, most of us would enjoy and be able to do? So we've seen a real shift, and where more people are able to access the community as part of their day opportunity. We've also seen, which was a real big signal to our day opportunity partners, how do we support people when they don't necessarily need a day service anymore? So how can we support people into employment or volunteering, or actually reduce the restriction because we've enabled people to develop some new skills and may not require something? So we've seen some real important evidence emerge where there's over 40 people who have gone through that journey where they've accessed a day service, their outcomes have been met, and they now don't access a day service. And we've got some lovely stories where some individuals have gone on to get employment, and that's the first time in their life that they've managed to do that. And that's in part because of the work the council has done with our external day opportunity providers. So if that's okay. And sorry, I should just add, in terms of what happens once the day services are established, so we have an accredited provider list, so providers are accredited with the county council, and then we audit them annually. And so we have a really revised audit process. So we want to make sure that the services where we're funding to support people who, some of them are really vulnerable, the majority of adults who access their opportunity have a learning disability, are they adhering to the standards we set? So, and what we're seeing through those evaluations is providers are generally giving really good quality care and support to the individuals who are being funded by the county council to access these provisions. And our audit analysis is showing, I think, really strong adherence to the specifications and contracts as commissioners we've set up on behalf of the council.
In relation to our own internal provision, the council runs and manages 8 day opportunity services across Nottinghamshire. That's in addition to our employment support service at Brook Farm in Limby, just down the road. It's very lovely to visit at Christmas if any of you are passing by. And we support, as Katie said, around 760 people each week that come to our services. Our offer is integrated both across age and disability. So we have adults from the age of 18 to into their 90s and beyond. We have had in some cases, and that may be people with issues relating to frailty and age, dementia, learning disability, physical disability, mental health issues, autism. The list goes on. The purpose of, as James said, we don't differentiate about who comes to an internal service and who goes elsewhere. It's really often down to, personal choice about where people would prefer. Sometimes it's because actually people have very specific needs that can't be met. An adult social care service operating in a bubble, we have an awful lot of cross-fertilisation with other local services. So to support the implementation of the vision that Katie and James outlined in the Day Opportunity Strategy, we have developed a new service offer for our in-house services, which has got a much clearer focus and we think better outcomes for people. Some people might require a relatively short period of time with us to realise their aspirations. But an awful lot of people that come into our services do need support over a much longer term to support them effectively. People can access and connect with their local communities, and people really actively shape and select the type of activities and things that we do within the service. And they've all got access to advocacy to help them to, say what they want in the way that they need to. So the key elements of the new Day Opportunities offer for the internal services, we have reduced the number of building locations from 10 to 8 to make sure that all of our buildings are well located and fit for purpose. Because all of them weren't. So we have closed and relocated from 2 buildings in the last 12 months. We've now got a new staffing structure and job roles that are more fitting for the future and more focused on individual outcomes. We've completely changed our programmes of activity, so that they're much more personalised around what people want to come and do, rather than this is the menu, come in and pick from what we've chosen. We've really turned that around so that actually people can come in and make a choice about what they'd like to do, and that it reflects their needs and ambitions. So we've developed 4 what we've called community hubs across the county, and we've also got 2 promoting independence hubs that are in development. We've created opportunities for ongoing listening events. So every week we have things like drop-ins, coffee mornings for carers where they can come in. We have listening events for people that, are actually in the service to hear, what do they want? Are they enjoying what they're doing? So that they can really input and shape how our services are developing. We're in the process of introducing carer information points into our community hubs, so that all of our carers, not just the carers that actually access the service, but any carers within that local area can come and get information about support services or contacts, opportunities for peer connection, so that carers are well informed and supported in their roles, because day opportunities does provide a huge amount of respite for informal carers. Our next phase of development is to fully operationalise our promoting independence hubs, and the purpose of those is to support people to maximise their independence. So this may be people that just need, short-term support. We're going to be bringing in things like occupational health, therapy clinics, and maximising independence service that can work with people to, perhaps reskill them after a period of ill health, or work on, supporting someone to develop new skills that will support them to be more independent and more self-confident. We're also working on the development of 2 specialist services within the provisions, so one for people with dementia and one for people with autism. Now, that doesn't mean that all people with autism or dementia accessing our services must go to those locations. This is for people who we can't easily accommodate or meet their needs in the wider mainstream community hub provision, but just need something a little bit more bespoke. So at the moment we're reviewing the physical environments of the buildings, because what we want to make sure is that they're fully dementia and autism friendly, and also we're designing additional specialist training for the staff who will work in those, so that actually they've got the right skills and training to support people in the right way. We're also looking at how we can make more use of technology. So what we would like to do is connect different services in different locations across the county, so that perhaps there's a drama group operating in Worksop on a Tuesday, but people in Gedling can dial in and link up, and actually they can do it together. And we're also looking at the potential of supporting people at home to also access things virtually. So that's another strand that we want to look at, and we just need to get our Wi-Fi connection sorted, but that's a whole other tale that you don't need to hear about. So the in-house service is very much trying to reflect what the commissioning strategy sets out to do, because we want to be as good as, if not better, than the external provision. That's always what we try and aim to achieve.
Okay, thank you. Okay, I'm going to move the recommendation, and Councillor Rich, would you second?
I second it.
Thank you. Okay, members' questions. I see Councillor Girling has his hand up.
Yeah, thank you, Chairman. A couple of things really. What do we attribute the reduction in people attending it down to? Has that happened before we reduced the buildings, or has that happened since we reduced the buildings? I've got a couple of questions if I may. They're all linked, but so that's one. How much of the numbers that do attend these things are double counted? Because I know the things I do in my community, you see the same people at every single thing that's available to them. So I'd be interested to know, what the real figure is and how many individual people is that individuals. And do your signpost went from the ones we run to those other provisions that are out there, and I was really interested in what you said about the looking at buildings that can be used as these community hubs. Does that include other local authority buildings, i.e. not ours, particularly as we're going into this reorganisation element? I do know, for example, the building I use for my pension Sunday Rose Club is owned by Nottinghamshire District Council. It's run by Reach. The building's sort of come to the end of its usefulness. I'm frightened they're going to knock it down and build houses there, when actually it's a really great community hub which does a lot of great things. And we all know in councils. It'll be down to the money it will cost to make it right. You know, and if we can support that in some way to make that happen, so it is kept or rebuilt as something more suitable, that'd be fantastic. Because as we all know, Aldenville is the largest council estate in Nottinghamshire, and it's got its massive challenges because of that. And that's a really well-used community hub, really, and I'd hate to see it go. In fact, I'll lie on the floor, swinging my legs around and screaming if they start to say it's going to happen. So I know it's a few questions within that, but I'm just interested to know those nuances of it. And if it is double counting, you know, what are we going to do really to spread it out? Because they're really worthwhile services that we provide, and the more people that attend them, the better, in my opinion. Thank you.
Okay, so in terms of so I'm assuming that what you're talking about is the reduction in our own internal buildings. So the reduction in numbers happened before we reduced the number of buildings, and that was one of the reasons why we did reduce the number of buildings, because it wasn't making an effective use of what we had. I think there's a number of reasons for the reduction in numbers. One was driven by COVID. During COVID, we had to close. We had no choice. All of our buildings had to close down. People's needs didn't go away, though. So we had to find different ways to support people during that period. And as other services were able to open up before we were, people were plugged into different things. They got used to them, they liked them, and they didn't want to come back to us. And that's absolutely fine. You know, that's people's choice. That's completely fine. So people stayed with the alternatives that they'd been plugged into. So we did see a reduction as a result of those, COVID-related changes. But also, as James described, we've put an awful lot of effort into growing the external day opportunities market. So people now have more choice. 10, 15 years ago, really, it was just the council-run services that were available to them. Now there's, a whole range of things that people can go and do. So, people's options and opportunities are much greater, and people have chosen to do other things, which again, I'm not precious about people coming to our services. That's completely fine. And actually, I see that as a real positive step that, people are accessing other things within their communities. In terms of double counting, no, we're definitely not double counting. We pull these numbers from individual records. So, the total number of people, that's why we're able to split it down into such precise numbers. So I know that the 762 people coming into our in-house service are not the same people that are also accessing services that James has commissioned. Yeah. Indeed. Yeah, I mean, some people access more than one thing, which is completely fine. But no, we can count individual people. Just remind me of your third point, the community hubs. So our community hubs, they are quite specific in what we need them to have in them. So we need fully accessible changing areas with overhead tracking. We need, fully adjustable changing beds. So they're all singing, all dancing buildings. They're not just general buildings that you might find in the community, because the needs of the people that we have, quite often we have an awful lot of people with very high physical needs who require personal care several times throughout the day. So we have got to have, specific things within the fabric of the building, and also things like, we have sensory rooms that people can use. So our facilities are quite bespoke to the needs of the people that we have. But as I said earlier, what we're really building on now is actually bringing some of the groups that operate within the local community around our hubs, bringing them in, or us going out for a period of time, so that actually we do have that connection, so that we are making more of resources within a district area, and I think those opportunities will grow as we get further into local government reorganisation. I think there'll be more opportunities for us to share experiences, share activities and assets.
Thank you. Oh, sorry, I've just got Councillor Wright. Well, we could come back to you. Councillor Wright.
Yeah, just a quick one. You usually get criticised a lot from over here, but I just want to praise Ashfield Day Service, to be fair. It's brilliant. The reason that I say that is I have a 32-year-old disabled son who goes twice a week, and it's his life. He loves it. No matter how much I can impress him, you're there. Whale. Okay, but just a massive thank you.
Thank you so much for. Do you know what, that you've made my day, because that's one of my services.
I'm filling up.
No, that's one of my services, and to get feedback like that.
I've seen. Thank you so much.
That's why we do it.
You sneezed in that. Yeah.
So thank you so much.
It's been going many years, but and the staff are fantastic. I'm sad when the retention of the staff is speaks for itself, and when someone goes that's been there, I think a lady called Wendy, when she's been like 30 years. I know her personally. I was devastated when she left. Why please don't go. But yeah, it speaks volumes. But it's outstanding. Okay, just wanted to say that. All right, you're welcome.
Councillor Rich.
Well, thank you, Chair. Well, I've got a random. I'm going to throw it out in the ball anyway with this HSC planning. So Wi-Fi. We're in year 2025, coming into 2026, and you've admitted there's not decent Wi-Fi. Have you got a digital care plan in place to rectify this issue? Thank you.
So we've been in discussion with colleagues in ICT for some time over this. There's some quite complicated issues. It's not just about, it's not like you or I getting a Wi-Fi network at home. We need new wiring, we need new data points. Some of it's around infrastructure within the building, because some of our buildings, when they were built, Wi-Fi wasn't a thing. So they're not networked in the right way. So it's not just a question of, just the Wi-Fi connection. It's a bit more complicated, but I have been assured that we now have a clear plan and timeline, and that in the coming months, all of our buildings will have the right digital infrastructure to support. And also we need quite a level of, obviously we're dealing with care records and all kinds of stuff, so our security has to be of a particular standard, and we need quite a wide bandwidth as well, because of the level of activity. So it's been quite complicated, but I've been assured that we're nearly there, and there's now a timeline to have this resolved.
Councillor Cowland.
Thank you. It's just a quick question. So I was sort of reading a bit about losing the sites, Mansfield and Netherfield, which is not my area, and I was sort of taken aback, and then I felt okay about it from other things you said, and then you just said that these sites have specialist beds and things like this, like quite complex facilities. So if you've closed these two, how far is it to the nearest one? Because people don't want to be travelling for hours.
So the reason that we closed those two, so Netherfield, firstly, wasn't our building. That was leased from it was a very complicated arrangement, but we leased that building, and that building did not have the right level of change in facilities that we needed, and it was very small, great location, but extremely small, didn't have good kitchen facilities, didn't have good bathroom facilities, and that was one of the key reasons why we decided that that would be one that we would come out of. Mansfield did have good change facility, very large building, but location-wise was dreadful. It was, off the dual carriageway, not in the local community, hidden away in the middle of quite an industrial area. That's not what we want for the people that we serve. But that was an old 1980 or probably pre-1980s building that, we couldn't do an awful lot with it because of its age and condition, but the location was quite poor for us. So that was the reason why we went with those two particular locations to come out of. We did need to contract because our numbers had fallen, but that was the rationale for those two particular locations.
Thank you. Councillor Girling, did you have a...
Yeah, it's just a point in terms of the response about the buildings, really. And I get it that you need them to be all singing, all dancing. And I suppose it's down to what level of day provision one might expect, if it's external or if it's internal. Because I see day provision as all sorts of things because of the benefit that they bring. Yeah, and we spoke about in another meeting about prevention being better than cure, because sometimes it's just a coffee morning where the elderly can go, because they're isolated, they get to talk to people, they get to find out, if you can claim for this now, and all the benefits that come with that. So to me, I see that as day provision as well. So I get it that we have these people with really complex needs, and absolutely we should be looking after them. But for a smaller investment, there's a lot of good that can be done, which will save a lot of money in the long term, because we all know what isolation does to people, and it's not a good thing. So that's what I was aiming at, really, where things are, everybody's under pressure, finances. Nobody really knows what's going to happen with the reorganisation. We don't know if this building's going to be part of the north or the south, and they've got County Hall. We don't know where that's going to end up. There's all these.
Sorry, Councillor Girling, is there a question?
Yeah, I think I'm just. Sorry.
So it seemed more of a.
Oh no, not really. I mean, it's about buildings, and that's the question. Is about buildings. So it's we've got to look at alternative areas where because there's going to be a gluttony of buildings available into each of those authorities, and I think investment now might save a lot of money in the long term, particularly in terms of what might happen to those people and preventing their helping their health journey, if you like. So I just want us to be aware of what can happen on that, and what we're doing about it.
So I'm just going to bring James in to give some examples that are not buildings based, really great examples that are also about building social networks, etc. And financially don't cost as much when we need the full range of things, but actually we want to develop more of some of these examples as well.
Yeah, thank you. And I think it speaks to the shift. So it's intentionally called Day Opportunities. And I think it speaks to some of the things you were just saying, Councillor Girling, where we want a breadth of things where people can access. And some of that is really important, regulated activity around their personal care, and really important things to support people to stay safe and have great lives. But there are other things people may want. And so we've set up really almost intuitively working with people who access day services or other forms of support. We call them community networks, where people come together, they really set the agenda. We have very minimal staff support to help facilitate and make sure, in one instance, a church is open and someone can get a hot drink and know where the toilets are. But essentially, they drive what they want, and they've set up walking groups, they've set up choir sessions, and really important things which we know is reducing the requirement for kind of paid, more formalised support and people are reflecting so positively that this is changing their life. They've made friends, and we've had examples where people have moved into properties, and instead of talking to the council in supported living around how do I set things up, they're talking to each other, people who are already in supported living, and said, well, this was my experience. And I think when we went back to 2022, talking with lots of people around what their opportunities meant, a prevailing theme was around friendships and being able to meet like-minded people and speak to people. And we know there's lots of reports, particularly from really established charities like MenCap, which tell us if you have a learning disability, you're less likely to be able to, for example, live in your own home or potentially have a job. And so some of the things we're creating really speaks to how do we make our societies and communities different and better to support people with different needs or different requirements. So our community networks, and we're in the process of setting up lots of iterations of that. And I think what's really a helpful point is we have lots of engagement from other partners, such as the police and the fire service. So people go into these networks, quite informal, and just make kind of the information known, which is I know what the internal services are doing as well, to really start to connect and not have what maybe a traditional view of a day service was, that it's just a building somewhere and people go to it and the world kind of works around. And that's definitely not our aspiration with the strategy. And I think we're really pleased that that's not what we're seeing either. We're seeing lots of diverse support.
Thank you. Councillor Butler.
Yes, thank you. A couple of questions. You know, when people have move on, when they've been on the programme and they move on, are they mainly going because it's their own decision, or is it because of something that's happened or funding pressures, whatever? So do we know sort of what the balance is in that respect? And also when people have left, do we keep in touch with them? Do we sort of see how they're getting on? What they're doing with their lives?
Thank you. So we definitely know that one of the major reasons people leave day services is health related. So the key is a health related reason. So somebody who potentially has either had a significant change in their life or may not require a day service. So around every year, about 100 people a year will leave a day service for those sorts of reasons. Sometimes, sadly, people may become deceased. But every year there's typically around the same number of people who are new people, perhaps coming through different ways, whether that's becoming an adult who was previously a child. So the numbers sort of net off. And in the report, what we try to be really clear is what's the positive. So sometimes that would happen anyway. Somebody may not wish to go to a day service. And what we try to work out is how many people are no longer accessing a day service or a day opportunity because they've achieved something, and that could be achieved new skills or developed confidence. So what we've recognised is we weren't, particularly before this strategy, very good at capturing that. We had no real mechanism to measure it. And we also know that's not going to be right for everyone either. So we now know, and we have that quarterly reporting come through. So every quarter we know exactly how many people have been supported through. And Ainsley do come in and help. From a social care perspective, we have duties under the Care Act in terms of regular assessment and review. So individuals who have typically been in receipt of services would likely get a review every 12 months to assess and appraise how they are and what their requirements are under the Care Act. And I suppose if they were to require additional support, which could be a day opportunity or something else, I don't know if you want to.
Yeah, I mean, people's life journey, all kinds of stuff will happen throughout the course of someone's journey. As James said, sometimes people are just not perhaps physically well enough to continue with what they were doing before. But that doesn't mean that their needs don't remain, and it doesn't mean that we withdraw, because as James said, we still do have a duty under the Care Act to make sure that people's needs were met. So, people's provision will change throughout their time with us, depending on how their needs change and adapt. Sometimes that's because of positive reasons. We have a big employment focus within the internal service. This year so far we've got 745 people into either paid voluntary employment or further education, that's a huge positive, but it does mean that they will exit day opportunities. But that's for a good reason. And, you know, as James said, you know, our social work teams will continue to track and follow people, regardless of which service they're currently in receipt of, because we do need to, you know, keep reviewing and revising people's support as things develop.
Thank you for that. And you mentioned employment as well, which obviously is a real big aim and ambition for our clients to aim for. On page 123 in that table, there's a box that says increased access to employment, voluntary and education opportunities. Now, the first bit of it says that meaningful access to employment has increased with providers working with internal, etc., and increase into volunteering and job opportunities. But then a little bit further down, it says reporting suggests that this is an area that requires further growth. So what do we mean? Oh, is that some sort of contradiction, or what do we mean by that?
I think it's more about our ambition. You know, although yes, you know, we've got more people, particularly people with learning disabilities and autism, into some form of employment or further education than we ever have in, you know, the 30 years that I've worked in adult social care. But we could still be doing more. So I think it's about the level of our ambition, because actually there is no reason why any person of working age with, you know, any disability or health condition or anything else cannot be supported into the workplace. So I think it's reflective of the level of our ambition. Yes, we've got a good number of people, but I would like to see a lot more, as I'm sure, you know, we all would. But, you know, that takes time, because it's not just, you know, it's about, you know, job market availability. It's about getting employers on board. And actually, we do have an awful lot of local employers who are really on board with us. You know, our iWork team have got great relationships with a lot of local companies who are extremely proactive in taking people on, trying things out and working with us in quite a different way. So I think the you know, the reference in the report is, yes, we're doing much better, but we could go further.
And that's really encouraging about the employment. But let's just hope that what's happening in the employment world and all the other challenges that employers are facing as a result, for reasons we know about, isn't going to make your task any harder. And I fear it will. But all power to you, because it's a really good service you're doing.
Thank you. We're a couple of years into this strategy now, over halfway. Really, in terms of obviously the day opportunity strategy, what do we see a reduction as a result of people going that would otherwise go potentially into sort of long-term care? And if so, what do we think the costs are associated with that in terms of overall reduction in costs potentially? What do we see?
I think that's quite a big question. What I would say is day opportunities is a really important part of an adult social care offer of support. And as hopefully we've described today, it's quite ranging in terms of there's some quite specialist support that might be in a building, through to support where you meet people, build a social network, meet at your local football club or cafe, places that you like, to work on goals that are about greater independence for you, particularly moving into volunteering and employment. And our whole adult social care strategy is to maximise as much independence for people as possible and work with people to do that. So I think the future is not necessarily about seeing less day services, but continuing to see this transformation where we've got the right range of support for people, because it's got an element of really good prevention in there. increasing independence. So I think we want to see more at that, some of those models that James has described. And I think I'm going to use the words of somebody who draws on care and support, that works with us a lot, that has been very open about sharing his experiences. He used to be supported in a day service in a building, and now does a lot of volunteering. And he talks about we need to think big with people, and how important that has been for changing his life, so that he now does the massive range of volunteering and impacts hugely on other people's lives, but also is helping us to change the way that we do things. But he talks about if somebody hadn't have come and had that conversation with him, he might not have had that future. So I think that ambition about it is really good, that we've supported more people to volunteer or to think about employment. That has to continue to be part of the future, and all of us supporting that ambition of people. And I think things that are connected around day services as well, day support. So Ainsley just talked about our iWorks service. So that's not just for people that might be accessing day support. People can be referred in from anywhere in the county that are not working if you've got a learning disability and or are autistic. And I've got people in my team that have come through that route that are brilliant members of my team, and people that have said things like, I thought I would never be able to have a job, and they're doing great things. So more of that.
I think the other point, Councillor Stoll, in terms of, does it prevent people from potentially going into residential care? As I said earlier, day opportunities is a massive form of respite for informal carers, and quite often it can be the thing that stops the home situation from breaking down, and informal carers from really getting to the end of the rope and not being able to carry on. We don't have numbers, but I would absolutely categorically say that the provision of this type of service is stopping people from ending up in 24/7 care, because it helps to keep informal carers continuing in their caring role.
I'll just follow up quickly. I mean, obviously there's there's this strategy, but when we also talk about the community-based sort of local organisations. So I have one in my division, the Core Centre in Calverton, which is a local charity that runs out of the Calverton Working Men's Club, and they operate on a 4-day a week, and they have people come along. Hundreds of people a month. Councillor Siemens has visited along with me, and we've seen the great work, and there's others numerous. Dyson Balls is another one in Arnold. My question really then is about if in other parts of the county where localised organisations don't exist currently, but people want to set them up, what assistance would there be from the county council to help residents set their own up? And obviously, we would definitely then see the impact in the community overall on reduced costs. Thank you.
I think there's two answers to that. I think for people who are eligible for adult social care under the Care Act, it's about supporting setting up those networks in a different way. So the examples that James has used have been co-produced with people that often there might be one support worker or two support workers that meets with that group of people, supporting them to decide where they want to meet, what things they want to work on and do together, which has been a really effective model. So we want to grow some of that. So that's where we would have contracted support to help grow it. Outside of the Care Act, we've got lots of really good voluntary sector groups across Nottinghamshire If people want to set things up, often they don't want to do that with the council, they want to do that themselves. It's often about a passion area, something that's important to them, or where they see a need in their local area. So lots of people might go to local businesses and be quite specific about, I want to do this thing, and can get some support, or go to a local building to say, really want to have somewhere for this group to meet. So people create those informal networks. They can do that really well, and I think we wouldn't want to get in the way of any of that. Where we have got the link with the council is we've got a range of voluntary sector grants. So it's over £1 million. There are some other grants on top of that have been government grants that have come in, that we've put out to voluntary and community sector as well. But over the last year, there's been some mapping of those grants, how they're working, etc. And we're starting to have some conversations about what we see in adult social care. And through a lot of our analysis work, of course, things like isolation comes up really, really regularly, and a range of themes that we'd all recognise in this room. So we're having conversations about how we might talk about those grants, and the voluntary sector organisations that are working with us, to look at adult social care more specifically and create more links. So I guess that's kind of 3 answers to that.
Okay, thank you, Katie. Okay, thank you everybody for your questions. Martin, anything to add? Okay, no problem at all, and we'll go straight to the vote then, if that's okay. Thank you very much. And Martin, would you like to present the work programme?
Yeah. So again, apologies that we gave you the cover report twice. So just to detail what's coming up on the 18th of March. So as detailed before, it's the care quality and assurance item. Then we've got the item on technology enabled care, which we've talked about a lot before. And then there's the adult social care performance, finance and risk update. And then if you go to the bottom of the work programme, which is available online, at the bottom there's items for briefings for members. So just to advise that the briefing paper on the joint work with health services will be circulated after Christmas. And there'll also be the performance update that will be coming out after Christmas as well. And then at the bottom, when we're advised by colleagues that there's the outcome of the inspection can be shared with members, there'll be a session for members to share those outcomes with you as well. And then finally, well, penultimately, we've talked about Brook Farm and the fantastic work that goes on there. So there is a visit to Brook Farm for the committee on the 8th of January at 12 noon. I will send you an invitation, so please come along because it should be really interesting. And the chairman has asked for other visits to be arranged at other services supporting adults throughout the county. So there will be more visits coming on during the new year.
Thank you, Martin. Okay, yeah, great meeting. I think we've had lots of good engagement from members, and we're doing our job. And, you know, I think the big conversation is, as I mentioned earlier, we as a council are engaging with the residents and service users across the county, and it's good that we're getting that feedback, and with the co-creation work that's going on, residents are having a direct input. I think ultimately though, what we want to see is that it's not just a talking shop, and that there are tangible results as a result of the engagement. We need to know that what residents' feedback translates into policy, and we get the best, obviously the residents get the best outcomes. With regards to the safeguarding, that was a very interesting piece. I won't pretend that I understood absolutely every aspect of it, hence why I asked for the future engagement sessions, but there were some good questions around that, and I particularly liked Councillor Wright's questioning around who holds the CQC to account, and I think that's quite key, and obviously we understand that a little bit better now. But it's clear to me that there is confusion amongst, if there's confusion amongst members, there can be even bigger confusion amongst the general public as well. So I think having those engagement sessions with us will assist us to explain that better with our residents. And lastly, I'll just finish on the day opportunities strategy. Really looking forward to the visit to Brook Farm and seeing the offerings that we have and interacting directly with residents and service users. I think that's a big thing. Again, something that Councillor Wright touched on. I was going to ask yourselves about success stories, but I think